Hello, I am Dra Adriana Ribé, a dermatopathologist and the medical director of Ribé Clinic, a medical center based in all the technologies for dermocosmetics. I'm very glad to introduce you today a new technology called ioveraº. This is the device that is produced by a company called MYOSCIENCE that is based in Silicon Valley. This device is used for the treatment of hyperdynamic wrinkles. So far, to treat hyperdynamic wrinkles, we have temporary treatments or permanent treatments. The most popular treatments are temporary and are based in botulinum toxin. Right now, I'm presenting here a new device to treat hyperdynamic wrinkles with a temporary result and free of toxins. This device is CE approved in Europe and in Canada for the temporary treatment of hyperdynamic wrinkles. This device uses the body's natural response to cold for the treatment of peripheral nerves. So what is very important about this technology is that we are blocking the signals from the nerve to the muscle. We are not damaging the nerve. We are producing what is called axonotmesis or second-degree Wallerian degeneration. So we're only degenerating the axon and the myelin sheath, whereas the endoneuron, the perineuron and the epineuron remain intact. So we are completely sure that we're not damaging the nerve, we're only producing a blocking and deconduction of the signal. Many studies have been done and we know that the axon regenerates 1 millimeter per day, and eventually when the axon is regenerated, the muscle moves again. As you can see, the device is a small device, it's handheld, it's simple, minimally invasive and easy to use. Whereas other cryotherapy-based devices in the past were big devices, complicated to use, and some of them produced necrosis in the epidermis. So the device has some consumables. There are two consumables. We have the smart tip and we have the cartridges. Once we inject the needles in the skin, we are producing a precise cold of zone in the nerve. And that nerve is the temporal nerve, is the temporal branch of the facial nerve. Once we apply the device in the skin, then we're producing what we call a cycle. The cycle has three phases. It has one phase that is to protect the skin. There is an area that is in contact with the epidermis and warms the skin in order to be in the safe side. We don't want to use the cold on the skin. Afterwards, the valve opens and the cold goes to the nerve. And the last phase of the cycle is what is called the post-warming phase. It's very important as physicians to know where we are applying the cold. We are applying the cold in the deep temporal fascia. And we know the nerve that we want to aim is there. So the treatment target is the temporal branch of the facial nerve. And the two muscles we are targeting with the treatment are the frontalis and the corrugator. So we know the device, we know the technology, then the next step is to do the patient selection. Patient selection, as in any other treatment, it is very important. And in this case, it's especially important because the results are immediate. The ideal candidates are males or females, 30 to 65 years of age, that are in good general health. Patients who have forehead and glabellar dynamic wrinkles. And as I said, it's not for the treatment of strong static wrinkles. It is also very important to see which candidates are not ideal. Candidates with eye-like ptosis, marked asymmetry, dermatochalasis or excessive skin laxity are not going to be good candidates for this treatment. It is very important while selecting the patient to assess the temple contour, because based on that we'll have an idea about the depth of the nerve. So the temple contour can be assessed by just watching the patient or using our finger pad. Patients with a concave, flat or even contour are very good candidates. Patients with a convex contour do not treat because the nerve is too deep to be able to be reached with the needles. The treatment guidelines steps are: once we have selected the patient, first, to draw the anatomical landmark and guidelines. 2. Treatment line selection. 3. Treating the patient. 4. Post-treatment care. So we're going to draw the lines. So first, we have to mark the following points. One point is in the root of the helix. The second point is 0.5 centimeters from the tragus, that is usually the intertragal notch. Dot 3 is 1 centimeter lateral from the lateral canthus, and 0.4 is 1.5 centimeters superior to the mark in number 3. So we're going to have two lines. First, the anatomical line that connects point 2 and 4, and then a second line that is called lateral canthal line that connects points 1 and 3. It is very important to draw these lines because anatomical line gives us an idea of the projection of the nerve. It predicts the trajectory of the temporal branch of the facial nerve. And lateral canthal line gives us an idea about the depth of the nerve. So it defines the inferior border of the treatment area. So once we have drawn the lines, we have two more other lines. One is at 1 centimeter and the other is at 2 centimeters parallel to the lateral canthal line. So I have drawn the lines on the patient, and now we are ready to start the treatment. Then it's very important as well the post-treatment care. We have to apply a gentle pressure to the temples using 4x4 gauge. That is very important. This area contains many vessels and lymphatics, so the chances to get a hematoma are high. So in order to avoid this, it's very important to apply gentle pressure. It's also very important to know which are the most common adverse effects. As with any needle-based therapy, there is the potential for temporary site-specific reactions at the treatment site, such as bruising, swelling, inflammation, tenderness, or hypopigmentation to the treatment site. The most common are inflammation and tenderness. These reactions do not require medical intervention by the physician. The patient may self-administer ice or even over-the-counter analgesia. The ioveraº treatment has a lot of science and technology behind. We know the mode of action that has been established over 50 years. Now we have a new handheld-used device. We get immediate results. They are precise and predictable, and is safe and effective. Currently, all physicians are looking for new technologies, new opportunities, and I think ioveraº offers you this, because attract new patients, retain existing patients, and differentiate your practice. In summary, this treatment works and it's safe. It's toxin-free, immediate results, and nothing left behind.
Hello, my name is Emilio, I'm 35 years old, and I was a bit worried about my wrinkles in my forehead. So I decided to go to Dr. Ribé to talk about this problem. The most important thing to me was to keep my natural look. She offered me ioveraº and I decided to try it. I was excited because she told me that would be natural and toxin-free. So I want to share the results of ioveraº with you. I'm very happy and I would like to recommend it to everyone.
Thank you for listening. It's been a great pleasure for me to have introduced you this new technology and the big opportunities that it's going to offer you. Hope you enjoy the technology and you offer a safe and effective treatment to your new patients.